Alright, so today I'll be giving a PCA of morphine. So to start off, I'm going to be comparing my physician's orders to my MAR. So we have Paris Marcy, Finn 123, 123, 456, 456, 789, 789. So you see that they have no allergies. So today we'll be giving morphine 1 milligram per 1 ml, 1 milligram per ml. It's usual 1 to 3 milligrams per ml. IV, given IV. PCA dose is going to be 1 milligram, PCA dose 1 milligram. Lockout is 5 minutes. So then I see that they're all double transcriber signs. Then I can go ahead and set my physician's orders aside. I'm just going to be placing them on the bed for this demo. And then I can take a look at my PDM. So taking a look at my PDM, morphine sulfate, it's a high alert medication. So I'm going to need another nurse to be given IV. It's an opioid analgesic. It may be administered by a nurse or a student nurse. So it's not for me. So I see that it is compatible with normal saline, D5W. Okay, so I'll be choosing normal saline after. So I'm just going to note some potential hazards just for future. So we have respiratory depression, shortness of breath, dizziness, confusion. So I'm just going to be noting those for later. I see for PCA, the dosage is just referred to the WRHA pre-printed physician's orders, which we checked with our MAR here. So then, for my dosage, I'm going to be choosing the first recipe for rates of 1 to 10 mg per hour, as it has a final concentration of 1 g per ml, which is what is ordered by the physician, the 1 gm per ml. So I'm going to need to draw up 50 mg, so 5, 10 mg per ml, 1 ml ampules, which I have here, into a 50 ml syringe, and then so add 45 ml. I'm going to be doing it in a mini bag. So adding 45 ml of normal saline, I have my normal saline, for a final volume of 50 ml and a final concentration of 1 milligram per ml. So once I've gone ahead and reviewed all that, I can go ahead and go grab all my supplies from Pixis, my medication, and then I can perform my first check with my medication vials, my PDM, and my MAR. So we have for our patient, Paris Marcy, we have our medication, so morphine, and morphine. Oh, so this one, and now in a clinical situation, these wouldn't be cracked yet or anything, so that it's fine if one falls over. So I'm just gonna be, because I'll be alcohol swabbing before I crack them. So then I'm going to, so I have all my morphines. So then I see this can be given IV PCA. This can be given IV, can be given IV, can be given IV, can be given IV, and can be given IV. So then the final concentration I want is 1 mg per ml. To get my final concentration of 1 mg per ml, I need a dose of 50 mgs. So 5 times 10 mg per ml vials, or ampules. So I have 10 mg per ml, 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 and they're all 1 ml ampules. So 1 ml, 1 ml, 1 ml, 1 ml, and 1 ml. So now that I see that they are all 1 ml ampules, and then I have my normal saline here, I'm going to be using as my diluent, so I'm going to need to pull out 5 cc's out of here. Okay, and it is to be given today now. So now that once I've done this check, I can go ahead and start prepping. So I'm going to starting off by removing some normal saline out of this mini bag. So I'm going to be removing 5 cc's. So I can attach a normal blend fill needle. Okay, and I can just set this down for a second. So I'm going to alcohol swab my port. So I'm going to swab my port here for 30 seconds, let dry for 15. Once that's swabbed, I can go ahead and remove my 5 cc's. Perfect, so I have exactly 5 cc's. I'm just going to label this right away, 5 mLs of normal saline, And I can go ahead and set this aside for the sake of space in this demo. I'm just going to place it in my little boat there. So then I can go ahead and start drawing up my medication. So I would swab all 5 of these vials now and crack them. And then I can go ahead and pull up my medication. Now in a clinical setting, I would be using a filtered blunt fill to remove the medication on here as they're ampules. But for the sake of this demo, I'm just going to be using a normal blunt fill. So now I'm going to be removing the 1 ml from each. Okay.
Now that my medication is on, I'm going to do a second check. So
I'm just going to make a little bit of space in my syringe.
Syringe. So stop embracing.
Okay, now I'm just going to cap this here. Now, because these valves have been used many times in the lab, these ones in this case had more, so I'll just dump into a garbage can, just the extra, or the sharps container, just a little bit of extra. So I make sure that I have my exact 5 ml dose. So then now I'm going to be labeling my syringe right away. So I have my label on my syringe. Perfect. Okay, so now I can go ahead and before I insert it into my medication, I'm going to do my next check. So I'm going to be comparing my medication label with my vials, my PDM, and my MAR. So for my patient, Paris Marcy, I have Paris Marcy. I have morphine. This is morphine. And now I'm just going to take a look here at my morphine. Morphine, and morphine. Okay, and then this is morphine. So it can be given IV, IV for PCA. This can be given IV, IV, and IV. So then for my dosage of 1 mg per ml, for the final concentration, 1 mg per ml, we figured we'd use this recipe of 50 mgs, so 5 10 mg per mls. So 10 mg per ml, and 10 mg per ml, 10 mg per ml, 10 mg per ml, 10 mg per ml, and they're all 1 ml ampules, so 1 ml, 1 ml, 1 ml, 1 ml, 1 ml. So when I pull up the 50 mgs per ml, I would have my 50 mgs per ml. I'm going to have 5 mls. So again, I'm just going to check, make sure I have my exact 5 mls. And I have my diluent of 45 mls of normal saline, as I removed 5 mls of normal saline there, and it's to be given today now, and to be given today now. So then once I have done that check, I'm going to stop and get another nurse to independently do a second check. So then once the nurse has done the independent check and they say everything's good to go, I can go ahead and insert my medication into my mini bag. So now, because I have a filter needle with the shards, I would be removing it and putting on a blunt fill, a non-filtered blunt fill. So I'm just going to keep this one on for the sake of the demo. But I would be putting on the non-filtered blunt fill because it doesn't have the glass shards. So then I can go ahead and re-swab my cord here, just to be safe. So I'm going to swab my port for 30 seconds, let dry for 15. Okay, then I can inject my medication. And I'm going to label right away. Just going to cap this. And I could discard this in the sharps. And I'm going to make sure to label my bag right away. So I have my label made here. So then I'm going to go ahead and head to the patient's bedside. So I'm going to be grabbing my MAR and just my mini bag here. So I'll be heading to the patient's bedside. So I'm just going to bring this around. So upon entering the room, I'm just going to be doing an entrance safety check. I'm going to be performing hand hygiene, introducing myself to the patient, and then I'm going to first ask to see their armband. So I'm going to be comparing it with my MAR. So I'm just going to see their armband. So for patient Paris Marcy, we have Finn 123, 123, 456, 456, 789, 789, perfect. They see they have no allergies. I'm going to ask, do you have any allergies? No, perfect. And can you verbally state your name and date of birth for me? Okay, once they say that, perfect. So then I'm going to go ahead and just do my third check really quick. So then I'm going to see my patient first, Paris Marcy. We have morphine can be given IV. So the 1 milligram per ml, as per PDM recipe, we saw that it's going to be in need a dose of 50 mgs and a volume of 5 mLs with the 45 mLs normal saline for a total of 50 mLs with a concentration of 1 mg per ml as 1 mg per ml, and it's to be given today now, and today now as they're not been given yet. So then I'm just going to note that there was no continuous. The bolus dose is going to be 1 mg. Bolus PCA, the PCA dose is going to be 1 mg. Lockout's going to be 5 minutes, so 12 doses per hour. So then once I've gone ahead and done that check, I can go ahead and educate my patient. So I'm going to tell them that they are going to be receiving morphine today for their morphine PCA for their post-op pain. So I'm going to be telling them that some side effects they could experience when on this are going to be shortness of breath, feeling lethargic, as PDM stated. So I'm just going to warn them of a couple side effects just to let me know if they experience anything out of the ordinary right away. Okay. So then once I've gone ahead and educated them, I note that the patient always does have the right to receive the medication. However, they've given consent, they would like to continue on with this procedure. So then once I've talked to them, I can go ahead and I'm just going to quickly assess my IV sites. You'll see that there is a primary running TKO. And I note that the IV site looks very healthy, no infiltration, redness, or swelling. So I just note that all the clamps are open, that TKO is running infusing good. So then I can go ahead and set up my pump. So I'm just going to turn it on here.
And then I'm just comparing. So the drug amount is.
So it's just turning on. So then I'm going to do program. Yes. So enter code. I'm just going to check the code. 94629. 629. Okay, so I would unlock it here. Then I'm going to enter all my medication. So my units are going to be in mg, yes. So concentration is going to be 1 milligram per ml. So 1 mg per ml, yes. So it's been given IV. We have our IV PCA, yes. So that we don't have a loading dose ordered. So yes. And med limits are off, good. So then next page. So we have our bag volume is going to be 50 mLs. So 50 mLs, yes. We have no basal rate. The patient bolus as checked is going to be 1 mg, 1 mg. So 1 mg, yes. The bolus interval, the lockout timer we said is going to be 5 minutes. So yes. And then the boluses per hour, as we saw, is going to be 12. So then yes, yes, done, yes. So then I'm just going to do the review. I'm going to get a second nurse to independently do another check. So they're going to independently do it. They're going to say, okay, everything looks good, everything matches. So then once they've done their check, I can go ahead and spike my medication. So now that everything matches, I can go ahead and remove the old medication. I'm just going to hang mine right here. Then I can go ahead and remove it. So now this just gets discarded. I'm just going to place it here for the sake of this demo. And then I grab my mini bag, and because they're used in demo, we just have to flip it upside down here. So I'm going to spike my medication bag here. Okay, so then once this is hung up here, and I see everything looks good, I can go ahead and make sure everything is attached. All the clamps are going to be open. All the clamps are going to be open and run it. So I'm going to run it here. Okay, so now that I see that it's infusing and I see the green light is going, so I know it's running. So I'm going to close it. I'm going to lock the PCA. So I see the green light is infusing, everything looks good. I see the patient has their PCA button in hand. I see that there is the green light, this is locked, they have their button. Now I'm going to perform an exit safety check, make sure they're in a safe, comfortable position. Again, one last time, just make sure all the clamps are going to be open. So perfect, everything looks good here. So then now, once that's done, I'm going to do my exit safety check, make sure the bed is lowered, they have their button, their call bells in place, they're in a safe, comfortable position. Then I'm going to exit and document. I'm going to document all my, when I hung the bag with the other nurse that helped me do the checks.